Stress affects the body. Hello, Cynthia Tieche here with Dr. Tieche in the Recharge Clinic living room. So, it's a family room, okay? Recharge Clinic family room.
I am.
Bonus room.
Anyway, I got to annoy her a little bit before. That's just how I am. I'm a child. Anyway.
Okay, so today we're going to talk about how stress can affect your thyroid. Because the other day we were talking and Dr. Tieche was saying, oh, you know, it's so crazy how stress can affect your thyroid. I said, that's what we're talking about. So let's talk. So stress can affect people's thyroid, which then affects pretty much everything.
Yes.
Okay.
So a lot of times I see people who have already been to other docs and they have a lot of the same symptoms. They are extremely fatigued. Some people are struggling with their weight, maybe having hair loss. A lot of symptoms of low thyroid. And they may have had their thyroids checked in the past and been told it was normal. When we reassess them, we'll find out that certain parameters in their thyroid are very, very low. And it's very interesting because this is well documented in the medical literature where certain ones, so I'll just kind of give a little lesson here and then go back to it. Okay. So there's TSH, there's thyroid stimulating hormone. That's what your brain tells your thyroid to make. It's like a thermostat. That's what most people check when they're checking blood work. Providers will check that. If it's in the range, they'll say everything's fine with your thyroid. Secondly, the next thing that people check is what's called T4, thyroxine. That's what your thyroid gland makes. It's called T4 because it has 4 iodines on it. Now, that is the inactive form of that hormone. Most people stop with those 2 labs, and those are okay. Regardless of what your symptoms are, they will say everything is fine. Now, the next really lab that people need to look at is what's called T3. And it has 1 less iodine because as it goes into the cell, 1 iodine is taken off. There's an enzyme called deiodinase that takes that enzyme off. That is it's like me, it's a very sensitive enzyme. I'm a very sensitive person. Anyway.
Is it really old too?
Oh, snap. I guess it is.
Hey, I had to go there.
Yeah, thank you. All right, fair enough. Fair enough. So it's very sensitive to environmental factors, but stress. And when I say stress, it just doesn't mean like, oh, I had a bad day stress and that makes my thyroid go down. Although that is something that does. It's really stress on the body. And so it can be from prolonged periods of having a stressful day or a stressful event that happens. Someone was in a car accident, someone had a child, someone had surgery, a death in the family, some kind of stressful event. What that does at a cellular level, and this has been documented, what they did was they did studies on people who were in the intensive care unit, who had major surgeries, and they found that almost all of them, their T3 levels were very low. And so what they started doing was looking for things that suppress that enzyme. And there's a lot of circulating inflammatory factors that our body makes in response to stress that suppress that enzyme. They don't really know why. They think it might be a way that the body goes into hibernation to sort of protect itself when you've had an event. But it really almost has the second. It doesn't really have that effect because when they measured these things in people in the ICUs and stuff, they found that they had a little bit of a prolonged recovery when their thyroid was low. Certainly, they had a prolonged mental recovery. It took longer, and their wounds took longer. But they don't really know why it does it. But it does it over and over again. So that is repeated in people who. So that's an ultimate kind of stress. Insult to your body where it's very well documented that enzyme is suppressed by factors that your body produces in response to stress. It just shuts it down. So what happens is, or what's interesting about that is in almost every one of those patients, their TSH was normal and their T4 was normal.
And so those are the things that, like he said, that's what most physicians or doctor's offices are checking, the TSH and T4.
And they found no correlation between TSH, T4, and a T3 level. So that's really important because if you are symptomatic and you're experiencing lots of fatigue, lots of just all of the kinds of symptoms, difficulty with weight, mental clarity problems, like that that you just know you don't feel right, and you go and you say, well, everything has been checked, it's been fine, and they haven't checked those full barrage, well, you can still have that problem because it's been very well shown. Now, there's other things that suppress it. Unfortunately, that's not if that wasn't enough to suppress it. There's other stuff. There's environmental factors that suppress it. There's the plastic bottles, PBA, all of those kinds of things. Glyphosate, which is what's in Roundup. All of these things now suppress that enzyme. So we have lots of factors. Honestly, even using lots of electronics have been shown to suppress it. Stressful jobs do. So all of these things have other ancillary effects to lower that, in addition to just the stress that you're having, which is causing it to go down.
Right.
So you're having these internal stress responses, which are suppressing that enzyme. So now your T3 is going down, your energy level is going down, your metabolism is going down. You're having all the effects of that. And then you have environmental stuff and other factors that are adding on to that. So it's no doubt that it's no surprise that many people have symptoms of low thyroid. Now, what's also been found.
So let me stop you there. So a lot of people might have these symptoms, run to their doctors and say, I'm having all the symptoms of thyroid. Can you check this? And the doctor checks it and says, everything's good. But that might not be really accurate because they're just checking the TSH and maybe the T4. They're not looking at the other. So just to address that, because a lot of people say, yeah, but I had my doctor check. But remember what he said, they're not checking all of these levels. And then
But it's even one step more than that. Even if your doctor were to check your T3 level, you really have to correlate that number to the person's symptoms, because most of this stuff is symptom-based, not lab number-based. And that's very, very important.
where do those numbers come from?
The numbers came from a congregate of hundreds of thousands of people that were checked. They have a low number and a high number, and that's what they said is the range. And those are just very weird reference ranges that are not meant as treatment numbers.
So even if you're in the range,
it doesn't
even if they
mean
check
anything.
everything, you could be in the range, have those symptoms, and really have it, but be told that you're fine.
Well, I mean, some simple examples of that are people who drink coffee. Some people put no sweetener in it. Some people put 1 sugar in it. Some people put 4 sugars in it. What is the range of sugars that people put in? Well, none to 4. Which is right? Which one is right? Well, there's none that are right. They're all right because each individual has a different person, a different one that they like that. So if I said you're in the range, I have some amount of sugar, you have some amount of sugar in your coffee. It might not be what you like, but I'm saying it's the range that I would normally give. So you have to put these things together. You have to say, okay, just by the fact that someone has come in and is asking to have that done and is having some complaints, they are in fact symptomatic. That's all it is. So by medical training, we are to listen to the person's symptoms and try and figure out what the problem is. Not try to say there's nothing wrong with you, but just they already have a problem.
So it's more than
That
just
is why
looking at
they're
it.
there. Yes, that's why they're there. If they didn't have any problems and their labs were fine, everything would be great. But if someone comes in and they're having a problem, you have to try to figure out what that problem is related to and what symptom group it figures it, that associates with what medical problem. And I can tell you these symptoms come over and over again to low thyroid and low adrenal, over and over and over again. And then you confirm them with the labs. Now, if the lab was super high and they had these symptoms, well, then that would be something that would be weird. It wouldn't fit. I've yet to see that, but most of the time it is on the low end of normal or just very low, which anyone would be able to figure out, even if you use those parameters. So you have to put all of these things into perspective. And the reason is, doctors treat things other ways that are not that way. But thyroid is the most commonly undertreated thing. It is the most common cause of most problems because it is the center of all hormonal balance. What happens is when your thyroid is low, your adrenal gland, and usually your adrenal and your thyroid go together because if you're having this stress response, which is whatever that might be, whether it be your body's under physical attack or you have some stressful event, the first response is going to be adrenal. Your adrenal glands are going to put out a lot of cortisol, which is what that hormone is, and then it gets depleted. So then you start having fatigue. Now your thyroid is trying to compensate, so it's making it, and then that goes down. So now you have two problems. This is called the HPA axis, and this is that hypothalamic pituitary axis, and that's what affects these two things. Then what happens next is testosterone. all interrelated. They cannot all be fixed one thing at a time. They have to be looked at together, and they all typically go hand in hand. And so the problem it repeats itself. So it's very, very common. So adrenal support and adrenal supplementation or low adrenal fatigue, whatever term that people want to use for that, is just as synonymous with that thyroid. So there's some estimates that say about 40% of the population is hypothyroid or has hypothyroid symptoms. 40%, that's half the population. So every other person has it. And it's because of what's going on. It's because of our exposures, our stressful lives, all sorts of things that cause it. No one wants it, but that's what exists. So we have to deal with it.
Okay, so this can all be related to just stress, just having a stressful day or environmental stress can affect all of these things.
Well, I wouldn't say just having a stressful day. If everything in your life had been perfect, you've had no stressful events, and maybe someone quit in front of you or something,
That's not going to affect it.
It's more stressful life events, and we all typically
A car
have
accident, having a baby, getting divorced.
Well, that in addition
surgery.
to having a stressful job that you work at day in day out, having children that you're carting around for all sorts of activity, trying to juggle all of this, have a demanding wife who is putting a lot of pressure on you. Not that I have one, but if you did have one, that could put a lot of pressure on you, and that could cause some thyroid stress. And so all of these things together compound that, and that's what they cause these things. Now, throw a surgical procedure or some kind of physical problem, that's going to release these other little factors that are going to suppress it even more. So there's lots of reasons why this happens.
So now let's just say you have these problems and you go to the right doctor who's going to check the right levels. How is this treated?
Well, it's a stepwise approach, So one of the things that we want to do, unfortunately, most of the time by the time I see people, they're pretty symptomatic and they're pretty desperate. So we end up, a lot of times putting them on some supplements that include iodine, selenium, chromium, things like that, which are thyroid supportive supplements. They help kind of support that production and help support that enzyme. But many times we end up having to put them on some thyroid hormone, particularly type T3, to bring that level up, to cure their symptoms.
Well, a lot of people, since we're going to mention names of medicines that people can relate to, have probably been put on, like every person in the world is either on Synthroid or levothyroxine, correct? So you've probably heard of levothyroxine and Synthroid. So what are they, and do you use those to prescribe or to treat this?
Okay. So levothyroxine Synthroid is a synthetic form of T4. That's the hormone that your thyroid makes. Most people that I see don't have. Some do. I'm not going to say all, but say most generally don't have the deficiency in thyroid production. They have it in the conversion problem. So treating someone who has a problem, if someone has just across the board low functioning thyroid, their thyroid hormone, their T4 is low, their T3 is low, that is a good start, because we don't know at that point if they're having a problem with conversion. So that starting someone on Synthroid would be a good choice. It's not a bad choice. But if someone has a normal T4,
hold on. We know about this, but let me slow you down for people who may not know about this. So you're talking about the conversion.
Correct.
So T4 converts over to T3.
Correct.
Typically, it
Yes.
should.
Yes.
So if their thyroid was low, putting them on T4 would be great because it's going to convert to T3 and everything is going to work.
In the perfect world.
But some people's body may not convert T4 to T3, and that's very important. So putting them on T4 alone, which is levothyroxine and Synthroid, isn't really going to fix the problem.
Correct.
So you would need to then what?
So there are some people who do convert a small amount of that. So really the target is, since there's nothing that we can actually go in and fix that enzyme with and say, here, this supplement, there may be at some point, but right now there's not. So, and we can't give that enzyme as a supplement. We have to do the next best thing, is really just give the T3 to bring that number up, to increase energy levels, metabolism, and such like as that.
Mm-hmm.
And that's really what ends up being done.
So, and typically this is this is a natural prescription, right? The T3, it's considered natural?
It is, because it's the same form that your body has. And so, what's interesting about some of this stuff, and when you started bringing it up as stress about thyroid, is that people, this is not a set it and forget it type of thing. And that's another thing that I see is people have been on thyroid medicine, the same dose for 10 years, and they feel bad. Well, it's not just that. Thyroid is very variable, and our bodies and our hormones are always in a state of flux. They are not just steady state all the time. Their levels change throughout the day, but they also change throughout the season of our lives. So when we're older, they're different than when we're younger, depending on our stress. I've seen my patients who have been hypothyroid, we've worked diligently to get them in that good level. Their lives are good, everything is fine. Some event happens to them, divorce, some tragedy in their family, and their thyroid levels go through the floor again. So we have to sort of, now whatever they're getting isn't enough. We need to be supplemented even more. Now, when things correct, you have to withdraw some of it because it ends up being too much. So it's really much more involved than just set it, forget it type of thing.
Of course, and your body keeps changing and you're aging, and like you said, different things may happen.
The other things too is one of the things that we do, a lot of our patients come in and they're on very bad diets. They've been overweight. They have not eaten properly. They've really been eating lots of processed foods, lots of things like that. And so while we're working with them to increase their thyroid, to get them feeling better, we're trying to work on the other aspects. We're trying to get them proper nutrition, proper diet, and things like that. As those things improve, the needs for some of these things go away. Sometimes they go away completely, but sometimes they don't. But that's going to change it. Someone who, is 100 pounds overweight and eats bad foods every day, they're going to be a mess metabolically. And they know it, they feel it, their body is not functioning properly. When we start to fix one thing, things start improving all the way around because they're fighting their body. They're basically poisoning with this stuff. And so what's going to happen is that poisoning is going to stop. And so the need for that stuff is going to lessen dramatically.
Yeah.
It's very
some foods are affecting this and just their body.
You take someone who has a gluten sensitivity or a gluten allergy, that's the key. They are ones that are very susceptible to that enzyme being affected. You start removing that from them, they just feel dramatically better. That inflammatory process, because it's causing inflammation. It's not the same inflammation as a joint pain. It's inflammation at a metabolic level,
and gluten,
cellular level.
Now, can't gluten also affect thyroid?
Yes.
So,
well, it doesn't affect it directly. It
okay.
affects it indirectly because people have a sensitivity or an allergy to it. Whatever term you want to use, either one is causing at a cellular level an inflammation and in the release of all of these cytokines and inflammatory products that now is affecting that enzyme to make it be less efficient. It's pretty interesting. It really does make sense when you think about it. Yeah. It's a bit overwhelming, but it's not just A is B. I mean, when you go to get your car fixed, not every time that your car's not running does it just need gas. It could be something else.
Right.
It could be the battery. It could be my battery. Check my battery. Well, it could be a problem with the cord. It could be the next thing. So you can't just take one thing and say, okay, well, your gas tank is full, everything is good. It's not that. You have to look further and further until you find the problem. And there is usually a cause. And it may be multiple causes. And some of them are difficult because when we're telling someone to change their life dramatically, don't eat what you're eating, eat these things, exercise. Those are painful things for people to do. They sound like they ought to be easy. But for people who never exercise, that's a hard commitment to make. And eating good, that's hard. It takes a lot of effort compared to eating a bag of chips or going through a drive-thru. And so that's those are harder commitments than taking a pill, for sure.
Oh, yeah.
But they're much more longer lasting, and they do have a better effect. But it's hard. That's what we do.
Okay. So if now, let's say you're in this situation where you probably, or you think, or that you do have some type of imbalance with your thyroid, maybe it is low. What are the symptoms of that, and can that affect weight loss? And I'm asking you this, but obviously I know the answer. But I do a lot of marketing on Facebook, and I put a lot of things on there about getting vitamin shots or vitamin IVs, or getting your thyroid fixed. If you're struggling with weight, it could be any one of these things. And I always get some random, troll on Facebook that says, "Oh, just eat half of what you're eating and you'll lose weight." But are there people that can eat half of what they're eating and not lose weight because of thyroid.
Of course. Whoever says stuff like that is very simplistic. I mean, that's just taking anything and taking a very simplistic approach. Do you think that these poor people haven't tried that? Do you think they're that stupid that they haven't tried calorie reduction or tried something? I mean, come on. Anyone knows that. So that's a stupid answer. It's very insulting to people. And these people.
It is insulting, and when I see that,
these people are already struggling. And I say these people, I just clump them together as hypothyroid people, not anything else. When you see people like that, and you talk, everyone has met someone that said, I really don't eat that much, and I can't lose weight. In the back of everyone's mind, they're going, "You're a liar.
right.
You're going home and you're eating chips." Now, there are some people who are doing that, but I can tell you, there's many that are not. And so what happens is, it is damn near impossible for them to lose weight and your thyroid type. It is impossible. So when you start doing it, if that wasn't the case, why does adding a little bit of thyroid with whatever diet they're doing, whether they're lying or telling the truth, affect weight loss with just minimal changes? So it happens over and over again. They feel better, either that or they're all lying. I mean, which I don't believe. And so that's a simplistic approach. All these things are just, you can't, life is not that simple. It would be nice if it was. All of our problems could be fixed. Like, let's all just get along. Okay, great.
Exactly. That is like saying, oh, let's all just get along. Why can't you guys, the whole world, just get along? It's like, do you think that we haven't tried that?
So
yeah.
Medicine and our bodies are much more complicated than that by design. And so, yes, medicine would be easy if we say, listen, if you didn't get sick, we wouldn't have this problem. Just don't get sick. I agree. It doesn't work that way. And so this doesn't work that way. If it was a different way, we'd have a different conversation. All I would say is, stop eating and you'll lose weight. And everyone would. It's not that way. So, there are many people, though. So the other half of people who don't have low thyroids, and even some of the ones that do have low thyroid, can do calorie restriction and have some weight loss. But the problem is the people who have thyroid problems, it's going to be very difficult for them. So they're going to struggle. They're going to have to do much more calorie restriction. So it doesn't matter if you're eating Nutrisystem or Oprah's meals or any other of that stuff that's out there. All of those are going to work a little bit in the beginning because you're changing your diet and you're having some calorie restriction. After that, unless you have really normal thyroid and are exercising and stuff, you're going to stall. And that's the problem. These people stall, and that's when they get frustrated and either give up because they said, listen, I'm just going to be a big person my whole life. I hear that every day. I'm just a big person. I can't lose weight. No one in my family can. When you check their labs, it happens.
So once you treat someone's thyroid, once we figured this out and you start treating them, how soon will they feel better and maybe see some results?
Well, that's a two-part question. How soon will they feel better? Probably within several doses, they will feel dramatically better.
And dose daily, so maybe several days.
Several days, because most people feel so tired, so fatigued, have so much mental fog from low thyroid. That improves very quickly. Now, it does take a little bit longer to ramp up your metabolism and start some weight loss, but that does happen. It's not like it takes years, maybe several weeks, maybe a month or so. And once we get that optimized, because we do have to make some adjustments, it doesn't go from zero to full.
Right.
And so
there's not one dose, there's several doses.
And everyone has a different dose. And so once we get to that point, then that starts falling into place. And we see this over and over again. It's not just one, wow, we have this one case.
No,
this is daily for
we
us.
see it every day.
And so it only becomes more and more reinforced. If you're doing a weight loss, if you have a weight loss program and you're not checking people's hormones, it's not going to be successful.
Right.
It's not. Yeah. Not that I'm anything against your program. I'm just saying you're only offering partial treatments. And that's part of the problem. It's just, there are going to be some people that get rid of this, but not everyone else.
Well, I mean,
if you have an ice cream store and you only offer chocolate, a lot of people are going to be happy with it, a lot of people are not.
Yeah. I mean, when I was a trainer, I definitely thought some of my clients were cheating because no matter how hard they worked out every day, and no matter what diet they went on, they didn't really, some of them, I had some that didn't see those results. And now I think back and go, oh my gosh, they probably had this issue. If I had known, I would have referred them to someone if someone was doing this. So, yeah, I mean, that's life-changing. And speaking about life changing, I posted something this week about some results that people have just told us basically that they've felt. They're kind of cool, so I just very well mention them on here. These are things that you just forget or you take for granted, basically, that you can do these things. But we've had several in the past few weeks mention that now they can finally pick up a pen off of the floor, tie their shoes, buckle their seatbelt, fit in an airplane seat. I mean, things that if you don't struggle with weight loss, you're thinking, what? That's crazy. But if you do struggle with weight loss, you know that these things will affect your life if you can't do simple things like this. And it's
Well,
life changing when you can.
well, I had a patient just yesterday tell me how his daughter went to graduation, and where their graduation was, he had to walk a little while. It was outside. He could not walk. He couldn't do it. He had to take a cart. He was so embarrassed because he couldn't physically do it because he was so out of shape, so out of breath. Everything that he did was impacted by his weight. He couldn't do anything. He just was slowly, falling apart. And then when he increased, when he started losing weight and feeling better, now he's able to do it. He's able to enjoy his children and his grandchildren, and everything has changed. It was life altering for him.
Wow. Yeah, I mean, these are the things that we see every day, and it's really cool, and it just reminds us when we're tired or when we've had a long day here that it's all worth it because these people are feeling really great, and we're happy to be able to offer all of this here at Recharge Clinic. So it takes the right doctor who understands what to look at and how to look at it and how to treat your symptoms. It takes some lab work, and it takes you understanding how you're feeling and communication. It's really like a little group of people here. You got to get your labs. You've got to have the right doctor, and then you have to be a big part of this also.
It's a team effort.
It's a
for
team.
Sure.
It's a team, but it all can come together and be fixed, and you can feel good, and you can lose weight, and you can do all of these things, and stop losing your hair. That's another huge one that we didn't really talk much about. But we're going to finish up for today. We offer free consultations in Recharge Clinic. If you're like, I wonder if that's for me. We have Dr. Tieche has a lot of trained assistants here that can help you and talk to you about how to get started here. So you can walk in or you can call. You can check out our website and come in for a free consult. And we will see you next